So here we're looking at a few surgical approaches to heart disease. So we have three main approaches that we'll be discussing. We have angioplasty, stents, and bypass surgery. So with angioplasty, you have a blockage in the artery, build up a plaque in the artery that is restricting blood flow. So for angioplasty, what you do is you take a catheter with a balloon on it. The catheter has a guide wire that leads it through the artery or to where the blockage is. Once in the blockage, a balloon is inflated. This balloon breaks up this plaque and opens up the channel for the blood to pass through. So with this balloon there, you now have more blood flow because of the improvement in space for blood volume to get through. You then have stents. So stents is very similar to angioplasty, but instead of just having a balloon when the catheter goes in, you have a stent that's a metal like a mesh wire that is able to line the inner surface of the artery and of the vessel in order to give it extra support. And so once the balloon is inflated, that stent is inflated as well, and that stent stays in place in order to allow that blood flow to continue even after the balloon is gone, because of the improvement in the diameter of the blood volume of the blood vessel. So the third you have is bypass surgery. So excuse the terrible drawing, but here's your heart. You have blockage right here that is restricting blood flow to this area where you see ischemic. There's the ischemic area where there's not enough oxygen to keep the muscle going. And so with bypass, you'll take a extra vein and you take it and you graft it in and you bypass this blockage right here. So the graft is able to go around in order to get oxygenated blood to every part of the heart through the coronary veins and coronary arteries in order to get the needed oxygen level to the heart in order to continue to function as it needs to function.